welcome to Chapter 15, Healthcare Reform and Individual Coverage. So in this chapter, we're going to talk about some key learning objectives. So we're going to talk about the defects in the U.S. healthcare system. We're going to talk about basic provisions of the ACA. We're going to talk about the major provisions of individual medical expense insurance. We're going to talk about managed care. We're going to talk about health savings accounts, HSAs, as they're also known as. We're going to explain the key characteristics of long-term care insurance. We're going to talk about the characteristics of disability income and insurance contracts. We're going to look at individual health insurance plans, talk about numerous provisions, renewal of policies, and other provisions that are mandatory by law. Okay, so first let's talk about the defects in the healthcare system of the United States. So there are four major defect areas that we're going to be talking about in this lecture. One is the rising healthcare costs. Two is the large number of uninsured people in the U.S. population. Three is the amount of waste and inefficiency in the system. And four is going to be the harmful insurer practices. Now, as far as the United States is concerned, we have a huge amount of rising healthcare expenditures. And it's been that way for a long time, where the cost of healthcare has risen faster than inflation by a great deal. So we need to really examine, if healthcare continues to escalate at such high percentage, it's going to be unaffordable for most people and unsustainable for most people in the country. So these increases have made it healthcare extremely expensive and an extreme amount of cost to the U.S. economy. And, just continuing year after year to grow at an extremely fast pace, a scary pace. Now, the expenditures for the country are about $4 trillion. So the national healthcare expenditures are $4 trillion. And that's almost 20% of the U.S.'s gross domestic product. So almost $1 in $5 are spent on healthcare alone in this country. And that, is very unsustainable in the long term. If we look at a survey, so there was a survey put together that looked at the healthcare of 11 advanced countries and economies. So we're going to be talking about what's in this. We have the UK, Australia, Netherlands, New Zealand, Norway, Switzerland, Sweden, Germany, Canada, France, and here is the US. So you can see on the scale, we're below the average and we're in last place. So, the ranking is based on 72 different indicators of healthcare in several areas, of which the U.S. did poorly in most of those areas, if not all. So it included access to care, administration efficiency, equity between higher and lower individuals of income, outcomes as far as performance, and overall the U.S. was last. So now, why this is important is because if we spend the most on healthcare and we're getting, out of these 11 countries, we're spending the most per person and the most entirely, why are we getting such poor outcomes? So this is something that we need to discuss. Now, let's look at some problems. Here is a list of problems in the U.S. healthcare industry. And one, advances in technology. So now, this is a reason for increased spending. So, excuse me, if you're wondering why the costs have gone up so much, one factor, which is not, I don't necessarily see this as that much of a negative, because advances in technology are good, although the U.S. citizens wind up paying for the bulk of the research and development and the higher prices for this advanced technology. Later on, when it's rolled out to the rest of the world, they pay a substantially lower costs or price, and they don't really pay much of the R&D. One area where I could give you an example is the U.S. pharmaceutical may pay millions of dollars to develop a drug, only for it to be mandated to be sold at a much lower price in foreign countries. So anyway, development of new technologies is going to be, it's always been a major driving force of healthcare costs. So one particular thing that we can look at is the MRI, which is a very expensive piece of technology. And some of the key research was done here at this university. If you look in the if you look in the chemistry building, you'll see a mock-up of an early MRI machine. But these were expensive, and the cost of these machines are very expensive. But that's a new technology that really revolutionized being able to image inside a person's body. Now, if we look at bypass surgery, bone marrow transplants, neonatal intensive care, certain procedures for blind people, different functions, and say artificial hearts and things of that nature, we find that the U.S. has been developed by the U.S. and made an industry standard by the U.S. And that has an effect of this advance in technology is also associated with higher cost of care. But also on a better side, it's also associated with better outcomes, less invasive procedures, quicker recovery time. So advances in technology isn't overall a bad thing for healthcare, but it does definitely raise the cost of healthcare. Now we can look at costs, installation because of third-party payers, and here we're talking about a system where the true cost of the healthcare is not paid directly for by the people receiving the healthcare. So most healthcare costs are paid by an insurance company or Medicaid or Medicare, and they typically, the costs are never really shown to the patient or the consumer. And why does this matter? Well, so for example, people who have health insurance have it through their employer or maybe through the government, and they pay a flat fee every month for that healthcare insurance, no matter how much of the healthcare they use. So now, think of it this way. Here's an analogy. Say, for example, there's your employer gives you a food card, and with this food card, you can buy as much food as you need every week of the year. So when you went shopping, you wouldn't really be concerned about the price of food or the price of food going up, or the fact that the particular market you're going to is more expensive than another market. And it would tend for you to buy more food than you needed, probably waste some of that food, and the overall outcomes would be total spending on food to be a higher percentage of everyone's spending. Because when you're not really paying for it directly, you're not cognizant of the price. So think about the way Americans shop for food. The supermarkets compete on price. They put out flyers, advertising specials. A huge number of coupons are issued to reduce prices. So the consumer is very price conscious when it comes to shopping for food. Now, if we look at the healthcare industry, we see that there are no price stickers on your healthcare. You don't know how much you're being charged for things. And this could, since there's no comparison shopping and there's no need for the companies or the doctors providing the services to really reevaluate prices or lower prices, prices tend to go higher. Okay. Now let's look at the employer-sponsored healthcare. So this is, since the employers sponsor the healthcare and you pay a flat fee every month, this is why you're not worried about the overall cost. You might be worried about what's covered, but if you know something's covered, you're not going to be worried about the overall usage. And but one thing you have to remember is that using healthcare is not a bad thing. In fact, going to the doctor for preventative checkups and getting to medical problems early is a good thing. So the use of the medical care system is not a bad thing, but there could be some overuse is possible. And one of the things that worry doctors is that they could be sued for malpractice. And this may cause some doctors to overprescribe tests and procedures just out of the wanting to have an abundance of care to insulate them from any type of possible lawsuit if they miss something. Okay, so going back to the employer-sponsored health insurance. So most people who work a full-time job, excuse me, they're going to get health insurance from their employer. And the health insurance you're not going to really have much of a choice. Some employers may only have one plan. Some employers may have 2 or 3 plans, but there really isn't a terrific amount of choice. So the U.S., can be directly traced to this employer-based health insurance is going to have 2 major things associated. First, the quality group of health insurance plans and the heavily subsidized and favorable income tax treatment. So employers receive income tax deductions for their contributions, and the contributions are not tax deductible as income to employees. So that means that as an employee, when I am contributing to my health insurance plan, the employer may spend $20,000. I might contribute a fraction of that, but at $20,000 that the employer is basically spending to buy this plan for me is not part of my income and is not taxed like income. So this tax exclusion for employees allows employers to offer plans that are going to be more generous benefits at a lower net cost. So this actually, the government, by making this tax advantages, makes it advantageous for employers to offer even more generous plans. And then, so employees can select, the more costly plan of healthcare insurance plans, which is not going to be that much more expensive to them due to the tax deductions, but it's going to drive up overall costs. A second thing that we could talk about is this third-party payments for healthcare insurance. So employees are insulated from the true cost of the healthcare, which we talked about before. Now, another reason for higher costs are this fee for service defects. Now, when you go to a doctor, the more things that the doctor does, the more they can charge. So every little thing the doctor does, they will put a charge on your account. So say, for example, I knew a friend who went to see a foot specialist because he had a pain in his foot. So went to see the foot specialist, and the foot specialist massaged his foot a little bit, put a special bandage with a cushion on it, prescribed a medicine, took an x-ray, did a reflex test, and all of these things were a separate and very expensive cost in the item. For example, the bandage that was put on, the charge was $700 for placing a bandage on the foot, which is ridiculous because the bandage itself costs only a few dollars, and wrapping the foot only takes a few minutes. So this is just an example of how all of these extra, that they could say, oh, I perform this, I can perform that. A doctor who's in a private practice can really escalate the charges to the insurance company by doing all these separate procedures, some of them which may not even be useful. So this person was put on anti-inflammatories and painkillers. Now, it turns out that none of this really helped. Later on, this person went to a different podiatrist, and they just basically said, there's nothing wrong with your foot. Everything's fine. You just have to do these stretching exercises. Your feet are just very tight from repetitive movement. And there's given a series of stretching exercises to do every night. No medication was needed. Problem cleared up within 2 weeks. So, this is something that, as far as a consumer, you trust your doctor, you listen to your doctor, but you don't always know. Sometimes the doctor is padding extra services to help them become richer. And this cost that gets added to the system raises everybody's health insurance costs and overall makes the system more expensive for everybody. So as far as a consumer, though, because we have this, this cost insulation, you don't care. Let the doctor do whatever they want. You're thinking that this is all going to be helpful, not realizing that many of the things they're doing is, not necessary, not going to help the situation, and just going to be an extra expense on the U.S. healthcare system for nothing. No real result to find. Now, if we look at higher administrative costs, there's definitely in the U.S. much higher administration costs for private health insurance plans. The paperwork for filing, the amount that people get paid who work in the administration side, it's just a huge industry, and these administration costs are extraordinarily high. Now, the costs on the administration side, you have to think about when you have health insurance. There's a company who's going to administer the health insurance, and they're going to have special paperwork and forms that need to be filled out. Now, on the doctor side, they're going to have to prepare the appropriate paperwork and submit the appropriate paperwork for the insurance company so they can get reimbursed. Sometimes the patient has to complete certain medical paperwork, and it has to be reviewed by the doctor or the insurance company. And then, so there's multiple people involved and a multitude of administrative paperwork that has to be put together. And this all is going to cost because many people in this administrative field, the doctor has to hire, a specialist to help with the insurance. They get paid a lot of money. The insurance companies have to hire people to process these claims and organize these forms and record them and enter them in the system. And that's all costs a lot of extra money for these administrative costs because of the way the system is set up. Now, there's also a lack of transparency in cost and quality information. We talked about this before. So we don't have a uniform, widely accepted standard for evaluating the effectiveness of medical treatments and procedures or technologies in this country. And, that is going to be a problem for both patients and healthcare professionals because, we can't get the best information for what is going to be the best procedure or the most cost-effective treatment for particular ailments. We just don't have that system in place. So there is a lot of information, but it's poorly organized, and the comparisons are difficult to make. So when we don't have this transparency of okay, if we do this procedure, this is the cost, this is the likely outcome, or we can do this procedure, this is the cost, that's the likely outcome. Just like an example I was talking about before, where the patient with the problem in the foot was issued 2 different medications, had special bandages, and other procedures done on the foot, when all they really needed was a good stretching program and strengthening program for the foot to relieve the pressure on the muscles that was developing from tight ligaments or tight muscles. And that's just an example of how there's no standard there. And that lack of, quality information of results tends to make the system more expensive. Now, there's also state mandatory or mandated benefits. So depending on the state, they can require health insurers to cover certain specific diseases for patients, such as, newly born infants, alcohol and drug addiction, mental health services. So states require health insurance to include services provided for certain types of providers, additional providers like chiropractors, psychologists, acupuncturists. So these mandated benefits increase the utilization of medical service and drive up costs. So what this is basically saying is that the state is going to say that if you're going to give health insurance in the state, there's certain minimums that you have to cover, and there's certain types of benefits that you have to offer. And although this is meant to be a good thing as far as, listen, we don't want to have these health insurance plans that don't cover these major costs, and we know that this could be a problem for consumers, so the state is trying to step in and regulate the industry a little bit to make sure that there's a basic level of service, but this can sometimes facilitate the consumer to overuse their medical plan more than they need to because of all of these additional options that are available. And if you take chiropractors, for example, many people believe in the benefits of chiropractors. Some people don't believe in the benefits of chiropractors. So it depends on the medical professional you're seeing. But typically, if you go to a regular doctor, they're going to want to steer you to where they can treat you and make money from you. And it could be something, I remember I had a medical situation that was really perplexing for my medical doctor. Couldn't figure out what was wrong with me and went through all these tests. Some of them were very painful and intrusive. And then, I coincidentally happened to be going with a friend to their chiropractic session, and they were going to get, an adjustment. And the chiropractor offered me a free evaluation. I did a free evaluation. I got adjusted. The problem went away the next day. It was like a miracle. And they explained to me it was just that, okay, because your muscles were so tight on this one side of your body, it was pinching the nerves down here in your spine, and these nerves, when they're pinched, they can produce this result. And I didn't care what they were saying. It just worked. After about 5 treatments, I never had a problem again. So you'd be surprised how chiropractic services, acupuncture services have been proven to relieve pain and fix certain situations that other general medical practices may have a hard time really getting good results with. Okay. Now, cost shifting by Medicare and Medicaid. This is another issue. So basically, Medicaid programs do not pay providers the full amount of what they charge. So in order for the government to try to keep their costs down through Medicaid or Medicare, so we're going to talk more about these two plans. Basically, Medicaid is something that everybody gets when they turn 65. Medicare is something everybody gets when they turn 65. Medicaid is a plan for generally people who are very poor can get Medicaid. So it's like an under disability or under a certain wage can qualify for Medicaid. But both these plans are run by the government, so they're going to mandate how much they pay for certain care that's received. Now, what this results in doing is that a majority of the people that are going to take these services are only going to pay the provider a fraction of what they charge. So this would mean that overall they're going to raise the prices to the people who are going to pay it in full. So it just winds up shifting the cost away from the governmental programs to the private programs. Another reason for the prices going up so quickly. Now this is one of the factors of prices being raised at hospitals and providers is because sometimes it's on a percentile basis, and so you get these crazy prices. You hear about this $50 for an aspirin at a hospital, or this really insane amount of costs associated, and part of it is this cost shifting where they're trying to make up for lost revenue. So rising prices in the healthcare sector. Of course, the prices of medical goods and services, increase more rapidly as time goes by, but the overall price levels have increased greater than inflation for a long time, and the rising healthcare sector, is going to contribute, to the cost of all the overall healthcare spending altogether. So it's just a problem where prices are continuing in all areas to spiral out of control. They have, when we talk about defensive medicine, this can be, what I was kind of mentioning this before, doctors pay a lot of money for malpractice insurance. The malpractice insurance is so expensive that the cost of it gets integrated into what they charge their patients. So doctors don't want to be sued, because if they get sued, the malpractice insurance premiums go up. Just like if you have a car accident, your car insurance goes up. So this forces a lot of physicians to do defensive medicine or healthcare, where they're trying to run certain diagnostic tests that, in their experience, knows are going to have very little clinical effect or very little value, but it's necessary for them to prevent a lawsuit or prevent exposure to a lawsuit. And oftentimes when you go to a hospital, they have a procedure. Or if you go to an emergency room, there's a procedure of what has to get done. Even though you could come in and the doctor could say, oh, this is clearly you're just this, just take this, you'll be fine. No, they have to run through all these tests to make sure they cover all their bases, even though none of those tests are really necessary, and a lot of times the doctors would know that, they still have to perform those tests as part of this defensive medicine. And that's it's overall going to raise the costs. So some of the issues here. Now let's go to problem 2. Many people do not have health insurance coverage. So this is a shame when we have such a rich and wealthy country, and compared to other industrial countries in the world, industrial leaders in the world. Why are we excluded from universal health insurance? Well, because we don't have universal health insurance, we rely on this, employer-sponsored health insurance for most people. So if you don't qualify for a government program, you have to get a job to get health insurance. And if you don't have a job or a spouse that has a job that can extend to you, you're not going to have health insurance. So it could put a lot of people in a dangerous situation because if a major medical procedure occurs during a gap of insurance, you can have an extreme amount of debt to pay for. So there's, about 9% of the U.S. population has no health insurance coverage, and that's a high percentage. So if you think about, 9%, it's almost 30 million people without coverage. So the cost of coverage is what is the major obstacle for the uninsured. They want coverage, but they can't afford it. So many low-income people are not always, you have to make a very low amount of money to be qualified for Medicaid, probably under $10,000. So many people are going to be in that uncomfortable middle where they make too much for a government program, and too little to really afford. And there's many employers where I worked for a company where the company provided zero amount of support for their employees' health insurance. So they did provide a plan. We have a health insurance plan, but the employees have to pay the full premium of it. And the full premium for some people were $1,000 a month. So for people who are making only $3,000 a month in income, they couldn't afford that extra $1,000 a month for the health insurance. So they just remained uninsured. And that is a problem because this could get them in a situation where they can have, if they have a medical procedure, and suddenly they're going to be in debt or go bankrupt based on the extreme costs. Now, there's also, we could also talk about harmful insurer practices. So the insurance companies, they can be a problem too. And so their practice can harm both the policyholder and the applicants for insurance. So here, let's talk about some examples of harmful practices. One could be exclusion of pre-existing conditions. So this is something that the Affordable Care Act, sometimes known as Obamacare, tried to make law that they couldn't exclude pre-existing conditions from your medical insurance. So a pre-existing condition is going to be some kind of condition that existed before you're able to establish your health insurance. Now, so this can be was a much bigger problem before the Affordable Care Act, but it's less of a problem now. So it's depending on the policy in the state that you're in. So the exclusion period can be anywhere from 6 to 18 months unless the condition was disclosed at the application and it was not excluded from a rider. So there's a lot of legal terms. So if it's disclosed in the application, the applicant was typically charged a higher rate. So these are things that if you're going for health insurance on your own, and you disclose that you're diabetic and you have these health issues, they're of course going to charge you more. So the Affordable Care Act wanted to make a widespread correction of this insurer practice and hopefully make some limitations that insurers weren't allowed to do a lot of this exclusion for pre-existing conditions. So, however, many insurers abused this provision and denied some legitimate claims because of pre-existing conditions that were not disclosed by the applicant. So this was a loophole for some insurance companies. You can see how devastating it is to somebody who's health insurance, and then when they need it most, their health insurance company claims that it's pre-existing and we're not going to cover it. So it's kind of a real shitty thing for insurance companies to do, but insurance companies did it because it saved them money. So that's why this regulation in the U.S. comes into play, because the government and the states are trying to regulate what the insurance companies are doing to make it a more fair and just system for both the consumer and the employers who are buying the insurance for their employees as well. So as far as, insurance contracts, they can limit benefits. So this rescinded individual health insurance policies, to avoid paying large claims, as claims dealing with advanced cancer or very large medical bill. This means insurers could try to cancel the insurance policy because of a misrepresentation, of fraud, a concealment of a pre-existing condition by the insured individual. So this is, this could be set up as a time limit to a claim. Individual policies, the insurance companies are going to try to set up a set of rules where they can back out of paying for your major medical conditions if they can find a loophole or a way out of it. And they can rescind, the coverage of the benefits and set up these time limits. So these are, again, tricky things insurance companies can do to try to get out of paying for your medical needs. And there's also quite often a lifetime or annual limits on your benefits, where, prior to the enactment of the Affordable Care Act, the Affordable Care Act is so important because it limited the ability for companies to do exclusions on pre-existing conditions, to rescind health insurance based on these time benefits, and try to limit the benefits based on, tricky timing, or these lifetime or annual benefits where, prior to the ACA, coverage could be cut off if you reached a limit. So maybe your policy has a limit of $500,000 in total. And once you reach that limit, you're on your own. So if you had a very serious health condition developed that's going to require extensive amounts of treatment over a long period of time, very expensive treatment, and you meet these annual limits, all of a sudden your benefits disappear. So that's something that the Affordable Care Act tried to improve upon or eliminate. And that's why, say what you will about the Affordable Care Act, when it's politicized and it becomes a bipartisan topic where, different political parties are trying to enforce it, remove it, make it a pawn, it really, shouldn't be a political issue, because it's really just, for most of the Affordable Care Act, it's trying to gain more medical insurance access to the average American. It's trying to rein in on insurance companies their tricks that they use to try to enhance their profits or limit their losses. Now, as insurance companies make a huge amount of money on their health insurance policies. They don't do this for free. They don't do this for nonprofit. They offer these insurance policies and they're trying to make a huge profit, just like the auto insurance industry. The auto insurance industry, they make a huge profit. If you think about, I pay almost $2,000 a year in auto insurance. So it's like almost a new car every 10 years, that I've used a fraction of the money I put into the car insurance. And the car insurance companies are quite wealthy because they charge a lot more insurance than they actually need. And that can be the same of a lot of health insurance companies as well. So the Affordable Care Act was something that was developed to try to make health insurance, one, more accessible to more Americans, and two, more fair to the average American as far as the amount of benefits and that they would receive, and the fairness being how they would be treated fairly by employers and insurance companies. So the ACA tried to prohibit insurers from issuing policies that were abusive or had abusive provisions that would harm consumers. And even this Affordable Care Act is very complex. Huge act with more pages than any one person could probably read. It it has made the health insurance available to many more millions of Americans. Whether you like the ACA or not, it did wound up increasing the health care insurance percentages of Americans, provided substantially subsidized insurance to individuals and small businesses, and made insurance affordable to many lower income people. So people who couldn't qualify for Medicaid could qualify for the Affordable Care Act and pay something proportionally reasonable to what they were making. And the provisions, it did contain certain provisions to lower the overall health care costs in the long run, which is very important. Now, let's look at some basic provisions of the Affordable Care Act. So this is the problem with the Affordable Care Act, is that most people don't understand it. And they listen to news shows or political pundits, kick this Affordable Care Act back and forth, why it's bad, why we need to get rid of it. And then some on the other side, you have the other political parties saying why we need to keep it and why it's good. So it leads to a lot of confusion for the individual consumer what this is all about. And most people aren't going to spend the time to really research and look up and find out what the Affordable Care Act is all about. Yes, there are some very good things in the Affordable Care Act. Yes, there are some things that are not so great about it. So it's a mixed bag for sure. But certainly, when you have certain political parties that want to get rid of it just for the sake of, hey, our political party didn't support it and we're not going to get any benefits from, doing this, so let's get rid of it because it's a bipartisan issue, that is a problem of American politics. And American politics are fine, but it's not fine when it's affecting people's health coverage or people's health outcomes. That's where many people wish that the political parties would put aside the differences and just work out a much more fair and just system where the average American can have access to health care at an affordable rate, and the system can eliminate all the excessive greed, waste, inefficiencies, and exaggerated administration costs that make so much money wasted in this area without getting good outcomes. Now, so no matter what, I don't care which political party you belong to, you should really, when you read the chapter and you listen to the lecture, think about what it has to say about the Affordable Care Act. So that way, if you ever do have a conversation with somebody, whether you're for it or against it, that's up to you. I don't really want to sway you either way, but at least you'll have the facts that you could talk about it in an intelligent conversation and not just, resort to believing what somebody else told you. If you can educate yourself on this, then you have a better perspective about it. Now, so let's continue with the basic provisions. So, one thing here, we have lifetime limits and annual limits are prohibited. So that's a good thing, right? So the lifetime limits and annual limits that would basically say you can only, once you spend $100,000 of healthcare costs, you're off. Everything else is up to you to pay. You can see how that would be really, terrible if you had $1 million hospital bill and your insurance kicked out after $100,000. So these limits were, for both individual and group health insurance plans, they're prohibited from placing lifetime or annual limits on the dollars of coverage. So that would be a good thing for most people if they get into this unusual situation where they have a very high medical bill. It won't bankrupt them. It won't put them, in the poorhouse. So that's I would say it's a pretty decent change that the ACA established. So in addition to prohibiting these limits to most health insurance plans, they do not apply to grandfathered or individual health insurance plans. So, some plans can have these grandfathered in, but the new plans can't. Finally, insurers can place a lifetime limit, an annual dollar limit for healthcare services not considered essential benefit coverages. So this is how there are some benefit coverages they can still do this to, but if they're not considered essential. Also, pre-existing conditions are prohibited. So the ACA says that, insurers are prohibited from denying claims or excluding coverage to pre-existing conditions. So if you're a diabetic, you lose your health insurance and you get new health insurance, they have to cover your diabetic health-related expenses. They cannot say this is pre-existing, we won't cover it. So you can see how this is horrifying. If you're changing employers and you're changing your insurance and suddenly these lifetime pre-existing conditions that you have are no longer going to be covered by a new health insurance. You can see how that's a real problem. So that's I would say, a relatively good thing that they're prohibiting these pre-existing conditions from excluding you from getting your health care. Now, grandfathered plans, when they say grandfather, that means that these are healthcare plans that were established before the ACA, and you would have to switch your plan if this was a problem for you. So you could see that even though the ACA, a lot of the provisions or some of them are just worked up for anything new moving forward. So you have to be careful if you have an old grandfathered plan or a plan that's going to be excluded from some of these provisions, that you want to make sure that you switch your plan to something that's going to be have to follow these new provisions. Okay. Now, here's an important one for college students, being able to retain your coverage until age 26. So it used to be that if you turned, in some cases, once you turned 18, you were off your parents' health insurance. In many cases, if you were in college, you can extend that to age 22. Now, in reality, there's many people who graduate from college and they want to go to graduate school, or they may take a couple of years until they get a job. So you can see how being able to stay on your parents' health insurance until 26 can be advantageous for a lot of younger people maintaining their coverage. So if you parents have a job where they have health insurance and your coverage, you can now extend that to the age 26, so they can keep you in their insurance plan until age 26. So that coverage is very helpful if you, as a young adult, haven't yet found employment, or you're self-employed, you just haven't yet been able to get your own health insurance. You're able to stay on your parents' plan a little bit longer until you're established. So I think a lot of college students would agree that you have enough problems. You don't want to worry about healthcare coverage right after high school or right after you graduate from college. Okay. Grandfathered plans. So this is something that before I do the grandfather plan, let me talk about, I skipped the guaranteed access to health insurance right here. So the guaranteed access to health insurance policies, so individuals and small groups can purchase through what they call the health insurance marketplace. We'll talk about this more in future slides. These are sold on guaranteed basis, so they're guaranteed renewable. So this basically says that you're guaranteed to be able to get health insurance and renew it. But it does have some geographical limitations that you should know about. Now, finally, grandfathered plans. So this grandfather term is sort of a term that's something that a plan that's been pre-existing. And for the ACA, they're talking about plans that were pre-existing before 2010 that have not made any prohibited changes. So grandfathered plans generally can remain the same and are subject to certain provisions of the ACA, but not all of them. So whether grandfathered or not, some provisions are going to have to be included in all health insurance plans, and this could be some of the provisions that must be provided would be the no lifetime limits for coverage, no removal of coverage for people who get sick from who have previously made an unintentional or honest mistake in their application, and extension of parents' coverage to younger adults at age 26. So there are some rules that can't be grandfathered into plans, some that can. Now, finally on this slide, the 80-20 rule. So here we're talking about This is a medical ratio or loss ratio, and it's going to refer to the percentage of premiums paid for health insurance claims and for the activities that improve the quality of care. So insurers, must meet a minimum loss ratio of 80% for plans in the individual and small group markets and 85% for plans in larger group markets. So this loss ratio is a ratio that's incurred. So you incur claims as a loss adjusting expenses to earn premium. So basically, it's sort of capping the amount of money that insurance companies can make. So this is going to be invaluable. It's trying to making the insurance plans a little bit more valuable to the people enrolled in the plans. And we want to make sure that if for each individual health insurance premium dollar received, the insurer must pay a minimum of 80 cents to benefits and keep only 20% for expenses and profits. So basically, insurance companies are limited to running on only 20% of the money involved in the plan. So, and that's for the small plans. Larger plans would be 85 cents to 15 cents as far as profits and expenses. So this is a way to make sure that there's no really greedy insurance companies are going to keep most of the money for themselves, that the actual insured person gets that percentage. Okay. So let's talk about some basic provisions of the Affordable Care Act. One would be the individual mandate. So now this is something that has changed. So in 2019, there was a change to this, so we'll talk about it in a minute. So basically, this individual mandate, you may have heard about it because it was talked about a lot in political coverage. It's basically a penalty for people who don't have health insurance. So if you opted not to have any health insurance, you would have to pay a penalty, which could be $650, $695 or 2.5% of income, whichever is higher. So that is basically a penalty for not having health insurance. So the idea here is if you have a large pool of people with health insurance, it's going to make the overall costs lower for everybody. So who doesn't want health insurance? Maybe the young and healthy feel like they could live without it more than the older population. So if you make a market and you force all the young and healthy people to have insurance, otherwise pay a penalty, that's going to make the overall cost of the insurance much lower because the insurance company is going to have a better balance between the healthy and unhealthy people, younger and older people altogether. So the individual mandate was meant to try to make a more fair and balanced pool of insured people by including a lot of the younger people who could skip insurance. But in 2019, the penalty for being uninsured was removed. So now this individual mandate penalty is no longer in play. And the new law provides premium tax credits to encourage enrollment rather than the penalty. So that's something that's changed since the original ACA. And, I could see how it can be unpopular. I can see how that can be unpopular, but it was meant to make the pool of people in the insurance a little bit more balanced for the overall population. Okay, so essential health benefits. If we look at this is basically all new medical expense policies except standalone dental, vision, and disability income, long-term care, must provide comprehensive package of benefits. So all new plans have to offer individuals basically a comprehensive plan. It can't be a medical plan that is missing certain key components. So the Affordable Care Act outlines what these essential health benefits are that must be within a medical plan to be considered complete and sellable. And this is to prevent healthcare insurers from making a plan that looks good on paper, but excludes a lot of common benefits that an applicant, that insured person would use. So this essential health benefits are meant to protect consumers who are going to be insured from any tricks a health insurance company may try to, manipulate the plan to look good in paper, but in reality, it's going to withhold a lot of the services that aren't going to be covered. Okay. Now, this you may have heard of the marketplace. So the ACA created a health insurance marketplace for each state. So the exchange was supposed to be a way to facilitate some competition in a transparent marketplace where individuals and small businesses could purchase affordable care and quality insurance plans. So they basically could go see what was offered, and competition would make insurance companies offer more competitively priced plans. And these marketplaces were going to be limited to, of course, U.S. and legal residents. And the state exchanges would enable people to comparison shop. So the idea of this would be to make insurance a little bit more of a marketplace, so that insurers will compete on price a little more. Okay. Now the new law provides premium tax credits. We were talking about this before, which is eligible to individuals to make coverage more affordable. So this again is limited to U.S. citizens who meet certain income targets. So employees who have access to health insurance to the employers are not eligible. So this is basically, if you are, going to get health insurance, but you're sort of low income, but not that low of an income, you may get these additional tax credits to make it affordable for you to get a decent healthcare insurance plan. So say you're making $40,000, you make too much for any governmental program, and you make too little to really afford a decent health care plan. The government will step in and give you tax credits to supplement and make you pay for part of the insurance, so that way you can get a decent health care plan. Now, there's also a law that provides within the ACA a cost sharing reductions. So to reduce the annual out-of-pocket payments for deductibles, co-insurance, and other cost-sharing provisions. So this is basically, if you're poor and you can't afford a lot of these cost-sharing co-pays, then if you qualify, your household income must be between 100 to 400% of the poverty line. So if poverty's at, say, 10,000, your income has to be between 10,000 and 40,000, and then the cost-sharing reductions, they're not going to apply to premium plans. Costs of non-covered services or balanced billing amounts for previous work outside the network, but they may cover things like, if you're, instead of your copay being $50 for a specialist, they'll pay half of that, and it's only $25. So it's meant to make, people who have low income not to be able to afford services where there's some kind of cost sharing reduction between you and the insurance company. And these would normally, you would think of these as copays. Now, if we talk about small employers, so employers who have a small business, less than 25 full-time employees, or when they say equivalent employees, that would be like 50 part-time people is the same as 25 full-time people. You can receive significant tax credits under the ACA to help small businesses afford to be able to offer health insurance packages to employees. So you can get this tax credit, but up to 50% of the employer's contribution is available to the employer's contribution if there's at least 50% of the premium. So the employer must offer coverage to full-time employees through this small business health insurance options program or shop. And this is a way to try to encourage small businesses to offer health insurance, because a majority of Americans work for small businesses. Also, the ACA expands Medicaid to include adults with incomes up to 138% of the federal poverty level. So this basically expands the eligibility for Medicaid. So many formerly uninsured persons now can have access to Medicaid coverage. But the Supreme Court did rule that states cannot be forced in expanding its Medicaid program under the ACA if they don't want to. So sort of this would be something states would have to agree to do this. They don't have to do it. because, of course, more people in Medicaid, higher expenses for the state overall. Okay. This law also contained a new law for important provisions to improve the quality of healthcare and lower costs, which include, rebuilding primary care workforce, prevention, and public health funds that will help invest in programs designed to keep Americans healthy, whether it's vaccinations or information or education, and focus more on patient-centered outcomes. So basically we want to do more research on patients and their outcomes and the quality. So this is basically trying to drive the some of the funding towards research or programs that overall are going to keep the medical expenses down in the longer run. Okay. Now, in continuing that, strengthening community health centers, providing funding for local and community health centers, trying to establish methodologies to crack down on healthcare fraud. There's a huge amount of fraud in the healthcare system. Some of them can be at your doctor's office, where the doctor is filing for reimbursements on medical procedures not done that you didn't receive, or it could just be fraud, I guess, at any level, really, in the healthcare system. Incentives for physicians to join together to form what they call accountable care organizations. So this is a way of sort of pooling their efforts together in a way. How can I explain it? I guess I would say it's an incentive to encourage providers to form these organizations so doctors can better coordinate a patient's care and improve the quality to help prevent disease and illness and reduce unnecessary hospital admissions if they're cooperating in this managed care organization, which is going to help hopefully reduce overall cost of care, so that way, they can recommend or give you a referral to if they see there's a problem, they can refer you to another doctor or another test, or that would help overall make you healthier in the long run. Reduce paperwork and administration expenses. So a lot of the ACA strive to standardize the paperwork so that the systems were similar between all different insurers and different doctors' offices. So you didn't have to have someone with, expertise in 11 different major insurers that keep the paperwork more uniform and standardized to help reduce those expenses. And then also driving the payments to physicians based on their value, not their volume. So we don't want this revolving door of patients running through seeing the doctor for 10 seconds and just being pushed along as quickly as possible. The ACA is looking to base some of the compensation based on the outcomes, the more valuable outcomes of the patients, and lessen the volume. So we want to make sure that physicians provide a higher value medical service. I'm not sure exactly how they do this, but this was a goal of the ACA. I don't know if they were able to achieve that, but it would make sense, and they do this in other countries, where your primary care doctor, as we call them, would take more of an overall managed view of your healthcare and make sure that they wouldn't just do requests when you visit. I have this problem, that problem. They actually would overlook, okay, you're at this age, you should be going to getting this service and getting that service, try to direct your healthcare in a more managed and valuable way, and not just sort of treat you and move on to the next so quickly. So making the doctors a little bit more involved in your overall healthcare management. Okay. Now, in 2017, the CBO projected the Governmental Budgeting Office projected that the ACA will have a net cost to the federal government of $1.4 trillion over the 2017 to 2026 period. And that would be partially offset by penalties and tax increases related to the coverage. So the funding of this law is supposed to come from the savings in Medicare and Medicaid programs. So they put certain changes in the way that these two platforms operate. They're going to produce some savings, reduce payments to the Medicare Advantage plans, annual fees on pharmaceutical firms and health insurers, and other tax and penalties were supposed to help fund this overall program. Now, it's such a complex program that these estimates are, should be taken with a grain of salt. It's really, the margin of error here is quite large. Okay, so right now we're about at the hour mark here, so this is going to be the end of part 1, and look for part 2 of this lecture to be posted right after this. Thank you.